Welcome to the Flourish with Neural Retraining podcast. I'm your host, Madeleine Lowry, founder of Twin Cities Neural Retraining and a certified MAP method practitioner specializing in anxiety, sensitivities, and chronic symptoms and conditions. Join me for episode 80, where we will hear from my client, Eriko, who describes her experience with the 12-week thyroid healing program. Eriko had been my client for a while before she decided to focus on her thyroid health. She'd been hypothyroid for 20 years and was on thyroid hormone replacement. After 12 weeks of neural retraining following the program, she was able to reduce her thyroid meds and even on the lower dose saw a 30 to 50% improvement in most of her thyroid symptoms. In our conversation, we discuss how the program has potential benefits for all chronic health conditions, not just hypothyroidism or Hashimoto's. Eriko wondered if her A1C levels would improve as a result as well. And after we recorded this session, she had some blood work done and reported to me that her A1C test results, which had been in the pre-diabetic range, had improved and were now in the normal range, another nice side benefit of the neural retraining process. As always, we must disclaim that the information we share in the podcast is for educational purposes only. As MAP method practitioners, we do not diagnose or treat disease. Instead, we work with the mind to optimize health. Now let's hear from Eriko. Yes, so welcome, Eriko. This is so nice to have you join me on my podcast to speak about your experience with the thyroid healing program.
Thank you very much. Yes, I'm really excited to be doing this. This is actually my podcast debut, so let's see how it goes.
Yeah, well, it was wonderful to be able to have this conversation with you. You know, when I put this program together, I really thought it would address a need for people who had, long-standing thyroid issues, for whom the usual ways of going about addressing the issue just weren't really hitting the mark. There are a lot of people out there that are frustrated with their body's response to thyroid medications. Some people aren't offered thyroid medication because they don't have lab levels that would indicate a diagnosis, but still they have the symptoms. And others have these diagnoses like hypothyroidism and Hashimoto's, but the usual treatments aren't working for them. And sometimes even increased levels of thyroid hormone can cause hyperthyroid symptoms as well as hypothyroid symptoms at the same time. And that can be frustrating as well. So I was really thinking, wouldn't this be great to explore how we can work with the mind to achieve symptom improvement, without having to do all the other things that are often suggested, or doing that in concert with the other things that are often suggested by other kinds of practitioners, like functional medicine practitioners. Maybe this is just a few opening thoughts from me, and maybe you can just talk about where you were at with your thyroid health and what you were hoping to address by using a program like this, which is a mind-body approach.
Right. So in my case, the thyroid medication that I was on was actually working. And so I was diagnosed with hypothyroid about 20 years ago. And ever since then, I have always stuck with porcine-derived thyroid medications. So, Armour thyroid, Nature-Throid, and now currently MP thyroid. And even though they were working in the last couple of years, I was beginning to feel that if I could get a handle on, in my case, anxiety and insomnia were the two biggest symptoms that really plagued me. And I felt like if I could just get handle on those two, I could probably get off of the medication. The other reason I really wanted to get off of the medication was the cost of the medication just kept going up year after year. they were the reasons I was really interested in trying to get off of medication. And at the same time, even though the medications were working, I really was still struggling with, some symptoms. Like I said, anxiety, insomnia. I still had those. And thyroid medication, it's something you really don't want to overdose because it can really tax your heart, and you can have heart condition on top of thyroid issues. So a lot of doctors, endocrinologists are really, they want to titrate very, very slowly, and that's understandable. But for patients, what it means is months and months and months of waiting for symptom improvement. It is just incredibly frustrating. So, so I thought that if there was another way for me to just resolve my thyroid issues altogether, so that I wouldn't be dependent on medication, that really would be the best thing for me.
Yeah. And over the years, I've worked with many clients that have hypothyroidism or the symptoms of hypothyroidism, even if they don't have the diagnosis, adrenal fatigue, chronic fatigue. And, I've seen many clients do really well with a mind body technique like this, which is essentially a stress reduction process, right? So they would come and do sessions with me, but it would be at least 6 sessions and often many more than that, to kind of get to the point where they felt like they had significant symptom improvement and or able to reduce their thyroid meds. And some even got to the point where their labs were no longer consistent with their diagnosis. Anyway, I was heartened, by those results. I work with people with all kinds of chronic health issues. So these were just people who were referred to me over time from functional medicine practitioners and other people that knew my work. And I also I had my work written up in a book, which I think is how you found out about me. Is that right?
Actually, no, I was already your patient previous to that. I think the book came out after I started working with you. Certainly, the book was how I found out how MAP can be used effectively for thyroid conditions.
Hmm.
And initially, when I came to you, I didn't come to you specifically for thyroid issues. I have a couple of other chronic conditions, and I was more interested in working with them. But the book was really helpful in that it gave me an insight that I don't think I really had before, that all the other chronic conditions that I had, which I always thought were just independent of my thyroid conditions, were in fact related to thyroid conditions. So, when you came up with this program, I thought, oh, perfect. This is exactly what I need, because like every other chronic condition patients, I've tried a lot of things, and a lot of them have fallen short. And because I had already worked with you and I knew how MAP worked, I felt really comfortable with this program.
Hmm. So I should probably just back up and say the book we are talking about is called The
Yeah.
Thyroid Debacle. And it was written during the pandemic by Dr. Eric Balcabbage and Dr. Kelly Halderman.
Mhm.
So it's co-authored by both. Dr. Kelly Halderman was a client of mine, and during the time that she was writing her chapters, so she decided to include the MAP method in her chapter on emotional fitness because she found that working with the subconscious mind through this neural retraining method was highly beneficial for her,
Mhm. Mhm.
and for the people that she referred to me. So that was probably the first book that the MAP method was included in, and it happened to be a book about hypothyroidism. So that was another, I think, just like another point at which I thought, yeah, maybe I should invest some time in creating a program that would address the needs of someone with low thyroid function. Yeah. So at this point, you have completed the 12-week program or 12 modules.
Yes.
Maybe you can talk a little bit about your experience with that and the benefits that you have seen from going through a process like this, right? Because
Mm.
it's different than doing live sessions. So we had done some live sessions prior to you embarking on this program. And I do think that a structured program like this is quite different than just coming to do one-on-one sessions.
Yes, and in fact, when I signed on with the program, that really was one of the unknowns to me. How a program like this that I could work on by myself without a live session with you would work out. But once I got started, I really felt very comfortable, and I actually I felt that in a way it gave me a lot of freedom because of the way that it's structured. I actually had the ability to go back again and again on the same topic and even within the same module if I wanted to. So I thought that once I got started, I felt really comfortable with the module. One of the things that I did struggle with. Yeah, I think there were maybe two struggles that I had, and one was, just making sure that I could carve out the time every single week to work on the modules. And in my case, what I did was to make a commitment that I would start a new module every Sunday.
Mm.
So, and, this being a 12-week program with an extra 4 weeks at the end, I knew I had some extra time, but I was afraid that, if I decide to spend an extra week on this module and an extra week on another module, at the end, I may just run out of time and never get to module 12. So I made a decision very early on that I was going to just start a new module every Sunday. And so that meant at least for me, that I would carve out 2 hours every Sunday to make sure that I would have enough time to listen to the lesson, do the journaling, and then, based on my journaling, pick a topic and do my first session for the module on that Sunday. And it worked out for me because by committing to the schedule, I would have at least one session out of the way. That made it easier for me to carve out maybe an hour here and there, 2 more days over that week. I just felt that just sticking to that one module per week and starting on every Sunday was 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 a commitment that I needed to stick to, and I'm glad that I did because it got me to module 12 by week 12, and at the end of it, I had time to look over my journaling and the other thing that I did for each session was to write. I wrote down a lot of notes for after every session because in a lot of the sessions I gained some sort of insight or understanding or a resolution that I just really was not expecting at all. I thought I think I should write this down because I had a feeling that it would help me to just read over them. So the carving out the time was the first difficulty, the one, not a difficulty but a struggle. The second one was that a lot of the modules work with memories, with emotional intensity, but because I had worked with you previously in live sessions, I was finding that I was actually running out of memories with a lot of emotional intensities. So that was a struggle. So I started working with memories with lower emotional intensity, where I have previously worked with emotional, memories with emotional intensity of 8 or 9 or even 10. Now I was working with emotional intensity of, 4 or 5. And at first I was thinking, oh gosh, I'm not sure how this is going to work. I'm not sure how meaningful the session is going to be, because the memory that I'm working with has such lower emotional intensity than I had worked with previously. But I was really pleasantly surprised that in a lot of cases I did get a lot out of it. I had a really great sessions, and I came away with some insights, some resolutions that really surprised me, and that really helped me. Yeah, so those were the two main struggles that I felt.
Mm-hmm. So again, I should probably just back up and explain that the structure of the program is 12 modules over 12 weeks. That's the pace. And if you do the program at pace, you're doing 3 brain retraining sessions each week. These are recorded sessions. There's one for each module. So each module introduces a new topic. You listen to a lesson on the topic. You have a journal prompt so that you apply what you learn to, you kind of look at your own life and make some notes about your own experience. And the product of the journal exercise is basically a list of possible topics for the session for that week. So again, when we talk about a structured program, modules are designed so that we move from simpler topics in the beginning, more about single emotional memories, to more complex topics like patterns. As you're moving through the program, you're tackling more complex, more involved, more entrenched patterns and behaviors, as opposed to just memories. So each module is an opportunity to explore a different part, I guess you could say, of your experience. So we have modules on things like fear and a need for control, a very common pattern that we see. As you talked about, one of the later modules is about blocks to self-acceptance and self-love. One of the advantages of working through a structured program like this is that when we work one-on-one in live sessions, you come to the session and you have to have some ideas about what you might want to work on. So you're using your own awareness, your own usually current experience to try to identify, what would be useful for us to work on today. When you're put through a program like this, it forces you to examine some things that you might not have brought up on your own. And you and I had done a number of sessions prior to you entering the program, but some of the people in the program are much more experienced with MAP, and some are even MAP practitioners themselves. So even with unlimited access to MAP, this program, because of my experience in working with people with all kinds of chronic conditions and seeing where the stress lies, I came up with this sequence of topics to explore that I think takes people who are willing to engage with it through a much more thorough exploration of their personal experience, of their personality, of how they relate to the world. And in doing so, I think it's a much more thorough process for reducing stress. It's a stress reduction program at its heart. It can be used for thyroid health, of course, but I believe it has benefits for whole body health because stress has effects on the whole body, not just this condition or that condition.
Yes, in fact, in some of the modules, I worked on conditions other than thyroid. I have a lot of joint issues, so I use the modules to for that. There were just situations where the memories with most the highest emotional intensity was associated with like my joint issues rather than with my thyroid issues, and I thought, well, why not? So, and I had really good results from that. So even though I enrolled in this program to specifically work on my thyroid, it really, just almost from the beginning, it really proved to be very useful for other chronic conditions as well. And because stress is at the bottom of so many chronic conditions anyway, I really feel like there's just really no need to limit yourself to just thyroid issues when you're working on this program.
Yes, yes, well said. Yeah, stress is definitely at the root of so many chronic conditions. So, at what point, you said almost from the beginning, but at what point did you recognize that, you were seeing benefits from the program?
Oh, I think I had a really intense first session, the very first session in the first module. I had a physical reaction. This was kind of weird, but I think that the experience of this session was so intense that I came down with eye infection. Which was really weird. But it cleared up in a couple more sessions. So yeah, I really feel like my body was kind of releasing toxins, and it just came out in the form of discharges from my eyes. That's what it felt like, and after a couple more sessions, they just kind of resolved by themselves. But I remember that in module 5, I had a really good session where I was able. I've had a very long-standing resentment towards my sisters over some family issues, and that was a topic that I had chosen for one of the sessions under module 5, and I had this great insight, and it was amazing. So once I came to that insight, I just got over the resentment, and it was so freeing. Feelings like resentment, anger, fear. All these negative emotions. They just take up so much energy to maintain. When you harbor negative emotions like that for years and years and years, they take up so much energy, and I think that this is a great program to just kind of liberate yourself, make things just lighter for yourself. So I felt that in that particular session under module 5, that's exactly what I was able to do.
Yeah, so module 5 is about current life stress for the middle of the program, and yeah, gives you an opportunity to kind of think about your life and what is causing you stress at this point in time. So
Yeah.
yeah.
And physically, I can't exactly remember when, but I think it was around module 9 or 10 that I was able to reduce my thyroid medication by a third. So I was taking 45 milligrams, but I was able to reduce it to 30 milligrams. So that was a pretty significant improvement. So yeah, and that came as you were saying earlier, the later modules really are more intense. And I think it was around module 8 when I started to think, oh boy, this is going to be painful. And then when I moved on to module 9, I thought, wow, okay, this is going to hurt. But I felt that when I got to those modules, and when I started journaling, I really felt that it was important to be just brutally honest with myself, and because in a way, when you're living with stress, in a way, you are deceiving yourself. You are telling yourself it's okay, things are bad, but it's okay, you can manage. You're kind of coming up with excuses to tell yourself that things aren't really that bad, or not, you can manage this. But your body is much more honest, and you start having some really serious health issues. And so when I got to, I think it really was module 9 when I really felt like, okay, I have to stop all that self-deception and just take a really good look at myself on the inside, and journal based on that, not based on what I tell myself to get through the day. So I thought that part was yeah, that part. Yeah, I guess that really should be considered as one of the struggles that I encountered. But I felt that if that really was a crucial step because, what's the point of doing these map sessions if your starting point is a memory or or a thought based on self-deception. You're not going to get very far. So even though that it was hard, I felt like it paid off in the end.
Wow. Yeah. So let me just thank you for sharing that. So I think that's a really important point, right? You said to be brutally honest with yourself. And that's why, that's another great thing about working with a program, right? You don't have to fess up to a practitioner. You don't have to share with anyone. You do your journal exercise yourself. You decide what's important, what the priorities are for you, and you take that into the sessions for the week. You can certainly decide, to skip over something you don't want to deal with right now. But of course, the more that you are ready to deal with, the more benefit you can get. And you talked about module 8, which is stress related to fear and control. You talked about module 9, stressful behavior patterns. That's like personality traits, like the fixer and the nurturer, the caretaker, the peacemaker, people pleasing, and things like that. These are topics that are very commonly see in my clients and that we work with. But, these are also topics that often require more than one visit to resolve because they are so pervasive. We're not talking about 1 or 10 or 20 memories here. Now we're talking about, years worth of memories here, reinforcing these patterns over time to the point where we think that's just our personality and it can't be changed. And, what I've seen as a practitioner working with many, many people is that these are patterns, but that doesn't mean that they can't be changed. Even very entrenched patterns can be changed. And this is the wonderful thing about working with the subconscious mind, right? So, this whole program is predicated on how much can you accomplish by working with the power of your subconscious mind. This is an opportunity to work in a different way by harnessing the power of the subconscious mind to really change your mental landscape on an emotional and a mental level, and then see the benefits of that, as we resolve layer upon layer of stress, including the subconscious stress that you don't consciously register, but is there. And so as we remove or we clear these strata of stress that have accumulated over your lifetime, that lightening that you talked about, right? Feeling lighter, feeling like, you can shed a burden, feeling like you can let go of something that like has been occupying mental space for a long time. These are all things that benefit you on a physical level in your physical health. Not right away, right? It's the cumulative effect of multiple sessions. In this program, you get 20 plus sessions. If you do 3 sessions for each module, it's like 27 sessions. So it's an opportunity, right, to do that deep work and kind of excavate, right, all these roots, all these stress roots that you've built up over your life. We all have, and that are weighing on you and that are making it harder than it needs to be for you to heal. Your body's natural healing capabilities are not optimized, when you're under the effects of stress. And so, what do now that you have been through this whole process, you've invested your time, right? You're very disciplined about it. By the end, what would you say you feel you accomplished by, going through this process?
The number one thing is that I got to know myself much better than I did before because a lot of this really every module really has forced me to look at past trauma really, right? And from different angles. I mean, often I worked on the same topic but in different modules, and each time I thought, well, this but it's the same topic, but this particular module asks the question, in a different way. And even though it's the same topic, I do have different thoughts about that, based on the way that the module asks the question. So, I think there was maybe like a couple of topics that I worked on in maybe like three different sessions. And every single time, and they were incidentally both topics that I had worked with you in live sessions previously. And every single time I was really surprised, and it gave me a deeper understanding. It allowed me to interpret that past experience in a way that I had never been able to before. And I came away feeling that I had gained, better understanding, not of the situation, but of myself, because these experiences are what forms me as I am today. So I felt like every session was an excavation into who I am. So I felt like I got to know myself better. And then when I came to the module 11, which is about self-love and self-acceptance, when I saw the title, I thought, oh yes, that makes total sense, because I've done all this hard work in all these modules, asking myself to look into past experiences, and being, like I said before, being brutally honest about who I am or who I think I am, my perception of who I am. And at the end of it, as I came to gain a greater understanding of who I am, of course, the last step is for me to accept who I am as I am, and also love myself as I am. So in module 11, to me, it felt like a step to feel more comfortable in my own skin, and which is just another way to say self-acceptance and self-love. The whole structure of this program made a lot of sense to me. I thought
Mm.
it was really logical, but it allowed me to delve deeper into who I am in tiny steps, so that, I mean, I couldn't possibly have jumped from, like, module 1 to module 11 right away. That wouldn't have worked. But the program is set up so that I could take incremental steps to build up to self-acceptance, self-love. And module 11 was a great way to end the program too.
Hmm. Yeah. So, yeah, thank you for that description. So, benefits. So, you talked about knowing yourself better and feeling more comfortable in your own skin. You've talked about being able to reduce your thyroid meds, which is great. Can we talk about symptom reduction as well? Yeah.
Yeah, so yeah, I did actually have some. My digestion really improved.
Mm.
So I had some constipation before, but yeah, I feel like that's just completely resolved. Insomnia, I did see an improvement over the last couple of weeks. So I have a situation going on that's being a little bit more stressful. So I've been struggling a little bit more with sleep. But I think the number one symptom reduction that I've seen is anxiety. Whereas previously I would have, well, I in late February I injured myself to a point where I just had to just kind of step away from work and not work for a couple more months, perhaps more. And that has a lot of ramifications, not just physically, but financially and emotionally. But when that happened, I was really surprised with myself to realize that I did not feel anxious. I knew exactly what the consequences could be, what the ramifications could be, but I thought, yeah, it's okay. So it could be tough for a while, but that's okay. That's what I have emergency funds for. I didn't have this, anxious reaction. Whereas before, I would have been, yeah, I would have been very anxious. I would have been just, asking myself completely useless questions like, what am I going to do? Asking myself, what am I going to do repeatedly on loop, every single day, every single hour, and without coming up with any useful answers. And this time I just sat back and thought, okay, well, I just have to take it easy because pushing myself at this point is just going to make the injury worse, which is going to prolong the recovery time, which is going to have even greater financial consequences. So the best thing to do is just sit back and do what I can to speed up the recovery. And I was really amazed with myself. That I've never had that reaction in a similar situation before. So
Hmm. Yeah. So coming into the program, I think you said earlier, anxiety was one of the
mhm.
main symptoms that you wanted to improve, to work on. Yes. And so certainly working through a program like this doesn't mean that you'll never feel anxious again, right? But I think one of the main emotional goals of the program is to help to kind of settle that mind so that the worry loops aren't running so easily anymore. Things are going to happen in your life that, of course, are concerning, like this injury and, your inability to work and the lack of income that means for you and, the impact on your career and so forth. But when we have a more settled, quieter, calmer mind, we can handle life better. The ups and the downs of life, we can handle it better so that this upset, which you can't change, right, doesn't have to drain you, like all the angst or all the anxiety that you would have had previously doesn't have to drain you of all your, resources and pull down your physical health as well. I mean, aside from the injury. I hope this is making sense to people because we do use up a lot of mental and emotional energy when repetitive negative thoughts and rumination and worry loops, all these patterns, right, are running. And so by working through a program like this and settling all of that, helping us to be more centered, more grounded, more present, able to deal with what is happening in the moment without all of those, as you described them, right? These useless questions, right? These projections into the future, a future we don't want, or an outcome we don't want, a situation we don't want to be dealing with, right? Can really, really take us down, including the rest of our physical health. But working through a program like this is protective of that. I like to say that working through a process like this, that the benefits continue to accrue even after you finish the program. Because now, as you said, I feel more comfortable in my own body. I feel like I know myself better. I feel more settled in myself. Unpredictable things that happen don't throw me off as much. That is all positive. Means that your response to stress has been changed on a fundamental level. And this is really what we want to accomplish because we know that people who have had traumas in their past, we all have, but especially early life trauma, those painful emotional events change the way that we respond to stress. And it changes the way that we respond to stress for the rest of our lives, unless we do something about it, right? We make a concerted effort to change that. And that is what I think this 12-week program
Mhm.
endeavors to do. It helps us to reset all of that so
Mm.
that we can respond differently to stress. And that means that we have more of our inner resources available to us for health and for healing. Mhm.
No, yeah, that's exactly what I felt because through a lot of the sessions, I kept coming back to my childhood, and I really felt like just because of the way that I was raised in my early childhood, I was conditioned to react to stress in the way that I currently do, even though it was so obviously detrimental to my health.
Yeah.
But that's how I was conditioned, and even though I knew that, I didn't know how to break that cycle, no, how to break through that conditioning on my own. And so once I started to work with you previously with in live sessions, and then through this program, I felt like I was finally making this breakthrough, just getting myself out of that really harmful conditioning and learning to react in a much more productive way, in a way that wasn't harming me, that was actually, constructively addressing whatever issue that I was faced with, rather than overreacting, which was my, previous standard way to deal with bad situation. So yeah, so I think you're right.
So, we talked about symptom reduction. I just want to go over some of the data that you provided during the course of the program. Is it okay with you if I talk a
Oh,
little bit about
sure.
how you rated your symptoms at the beginning and at the end? Because as part of this program, we have each participant rate their symptoms in week one. So symptom severity on a range of symptoms, typical for, hypothyroidism. And then we have them rated again in the middle and then at the end. So after they complete the entire program. And so I just want to point out, I when I compare your initial ratings of symptom severity and the ratings that I don't know if you've even looked at this, right? By the end of the program, symptoms like fatigue and brain fog, bloat, hair loss, anxiety, feeling cold, aches and pains, dry skin, heart palpitations. This is not the entire list. These are the symptoms that you rated as being improved, significantly improved. So for fatigue, you went from a 7 out of 10 to a 3, brain fog, 6 out of 10 to a 3, and similar for all these other symptoms. They were 30 to 50% better than the original rating. So similar, 6 to a 4, 6 to a 3, 7 to a 3, it was kind of the same level of improvement for many of these symptoms that are very typical for people with hypothyroidism. So I see that as a positive as well. Yeah, even the heart palpitations, 6 to a 3 by the end. So it's not gone, right? It didn't disappear, but I think that, especially considering that you were able to cut your thyroid meds by a third, and still by the end of the program, you had symptom improvement on that lower dose, right? I think that's a very positive result. So,
Yes, I really was, when I cut down my dose by one third. I was initially a little skeptical if I would be able to maintain the new level, but it's been I think it's been over a month now, and I'm still at 30. So it
mm,
looks, yeah, I seem to be doing fine at this lower dose.
and stressful things have been happening to you.
Yes,
Yeah.
yes, briefly I thought about increasing the dose, but I think I'm fine. I think I'll be able to deal with this.
hmm hmm And so, what are your thoughts about, whether you would recommend the program to others and for whom and for what kinds of situations or issues?
Yeah, I actually would recommend this program to pretty much anyone really, because even though I mean, the word thyroid does appear in the title of the program, it's that it really, I think, has a much wider applicability. So anyone who is struggling with chronic stress, and probably anyone who is dealing with chronic conditions of any kind. Like I said before, I am struggling with chronic conditions related to my joints, and I've had that for like 40 years. So that's been really help. The program has been really helpful for that, as well as thyroid. I know what chronic condition is. People with chronic conditions, we just go through, we try so many different things, and we are continually disappointed with different things that we try. And every time, we come away feeling, okay, yeah, that was another bus, that was another, I don't know, $500, another $1,000 that was wasted. And after a while, we get really jaded. But it's this program has really paid off for me. I think other people with chronic condition would be helped as well. But I was also thinking, there are a lot of people with chronic stress because of work or family, maybe they're caretaker for a family or whatever. It's if anyone with chronic stress situation, I think would be helped. But this goes back to being brutally honest with yourself. It is really important to be brutally honest with yourself that number one, you are in a chronically stressful situation. And you've probably tried a lot of different things, and if it hasn't worked, it's time to move on to something different because it's not helping you, and you're not going to get out of it on your own. It's just gotten to that point. I think a lot of people just try to tough it out. They think that this is something I can handle. I just need a little more time. And you've probably been saying that for 2 years, 3 years, 10 years. Then yeah, it's time to try something. It's time to get some help.
Mm,
Yeah, I really don't see any need to limit this program to people with thyroid condition at all.
mm. I agree with you. It is a stress reduction program.
Mhm.
As you said, anyone who recognizes that they are stuck in a fight, flight, freeze, or a sympathetic dominant state, people who recognize that they are living under significant amount of chronic stress, that's the thing about working with the subconscious mind that people don't really understand because they think, well, but you're not going to change my situation at work or the caregiving situation I'm in, or my relationship stress, right? You're not going to change any of these very real issues in my life. So how is this going to help? And it can be hard to understand. I mean, it was easier for you to understand because you'd already worked with me in live sessions and you could see how working with the subconscious mind can really change your perspective. Even on, yes, definitely those are stressful situations, but this amount of stress that we feel is related to more than just the situation you are facing right now, right? Because every stressful situation is ringing a bell going back to other stressful situations that have made you feel the same way throughout your entire life, right? Because to your subconscious mind, there is no sense of time. Everything is now. And so by working with the subconscious mind and finding all those associated events and neutralizing them, so you still have the memory, it's not like we're erasing memories, but we are neutralizing the emotional intensity around this group of memories, then the situation that you are facing today can feel more manageable. It's not spiking, right? The anxiety at an 8, 9, 10, the way it would have if you hadn't done that work. And that's what you're finding right now with this injury that's put you out of work for several months. That's a stressful situation for anyone. But because you've invested the time, you've done this work, you've kind of reset your mind to a different response pattern or, response level, you can now look at this same situation, which would have put you at a very high level of stress before, and be much more accepting of it.
Yes. Hmm.
Yeah.
Yeah. Yeah,
Hmm.
that's true. And earlier when you were saying about how doing MAP or this program wouldn't necessarily change the stressful situation that people are in. That's true. But I think what it does do is to it's like giving you more room in your mind to be able to look at your situation in from a much calmer perspective, and maybe you can see a way out, or maybe you can see a way to manage the situation that you weren't able to before because you were in probably in a panic mindset.
Yeah.
So I think that's one of the benefit. Even if you can't change the situation right away, maybe you can strategize. A lot of people just don't know how to ask for help. For whatever reason, they just don't know how to ask for help. But there's nothing wrong with that. And I think that working with MAP and getting over whatever hump that you have that makes you think that you shouldn't ask for help. Maybe you can get over it, realize that it's okay to ask for help from friends and family. It's okay, they love you, they want you to be happy, they're willing to help. I'm sure there are situations when there just really is almost impossible to change, but I think that gaining a new perspective could go a long way to possibly changing the situation that you're in.
Yes, and I feel like we're talking about module 10, stressful core beliefs and identities, right? People who
Yes.
can't ask for help, right? It's like, what is it that you believe about yourself, about others, about what it means to ask people for help? That is something that we definitely work with in the program. Well, thank you so much for joining me today. It's been really lovely to have this conversation with you and just hear more about your experience with the program and how it's helped you. And I'm just so thankful, Eriko, that you came to speak with me today.
Thank you. I had a really good time working on this program, and I hope that other people can benefit from this as well.
Yes, thank you. Yes, it's a commitment for sure.
Absolutely. It's totally worth it.
Thanks for joining us for the Flourish with Neural Retraining podcast. Please listen again and remember to follow us and leave a review on iTunes, Spotify, Amazon Music, YouTube Music, or Pandora. Check out our free courses about the MAP method and all of our MAP programs, including the Thyroid Healing Program, at mapforhealth.us, or schedule your introductory MAP session at tcneuralretraining.com. Until the next time, be well and flourish. Content of this podcast copyright 2025 by Twin Cities Neural Retraining. Music by Barbara Ben.